Hello, I'm Jennifer Walker. Welcome to this session. I'm really excited to be chairing this session and to be introducing four really exciting groups of speakers to talk about experiences with Indigenous health and well-being and data linkage from around the globe. So I'm excited about this whirlwind of experiences we're going to hear about. I just want to invite you to put your questions into the live Q&A, and we'll touch on those and they'll guide our discussion after each presenter has had a chance to speak. So first I want to welcome and introduce Nathan Nickel and Wanda Phillips-Beck, who are presenting Measuring Community Strengths Using Data from the First Nations Regional Health Survey linked with a whole population administrative data repository. Thank you. Please go ahead.
Thank you very much for having us. As was mentioned, I will be co-presenting today with Wanda Phillips-Beck. Today we're gathering from Indigenous lands from all over the world, and personally I acknowledge that I am a guest here on Treaty 1 territory, which was traditionally the homeland of the Anishinaabe, the Cree, the Oji Cree, the Dakota, and the Dene peoples. I want to express my honor to the elders and knowledge keepers, grandmothers, both past and present, and also that I'm a guest here on the traditional homelands of the Métis Nation. Many harms and atrocities were carried out on these lands, and the effects endure to this day. But us at the Manitoba Center for Health Policy and at the University of Manitoba are committed to moving forward in true partnerships with our Indigenous colleagues to do work in the spirit of truth, reconciliation, and collaboration. This work represents the efforts of a whole team of individuals who are presented here on this slide. And I'll hand it over to Wanda at this point.
Thank you, Dr. Nickel. Anin Tansei, Tigigije Begun, Wabshke, Wabigun, Indigenous. Welcome. My name is Wanda Phillips-Beck. I'm Anishinaabe Kwe from the Hollow Water Territory, Treaty 5 Territory in Manitoba. And the reason we're talking to you today is about research and doing research in a different way. We all know that the impact of colonization has been very harmful to Indigenous people. And for many, many centuries, we have been keeping ourselves well, and we have been resilient, and we have thrived in our environments. And we have done this by learning and many, many centuries of observation. And we have learned to live in harmony with our environments. And we have learned through passing down of information and knowledge from our knowledge keepers and those that had kept the Indigenous science alive. And we know that colonization has interrupted these pathways. And we learned from our environments and from our surroundings and from our bodies about what kept us well and how we thrived and learned from many, many years and centuries of observation. Unfortunately, due to colonization, this knowledge pathways have been interrupted. And now we have seen a surge of research that has harmed our people. They have looked at our deficits and used models that we weren't accustomed to and weren't strength-based. And so we are reclaiming our science, our ways of doing research that is not necessarily deficit-based, but we look to opportunities to use strength-based research and Indigenous paradigms and Indigenous frameworks to look at our health and our well-being in a different way. So the Western paradigm often was very harmful by perpetuating these deficit-based narratives. So in this project, we wanted to look at other factors that have kept us strong and kept us resilient for many centuries. So we used a method of looking at a regional health survey, which is a survey that First Nations had designed and developed on our own, and we used indicators that were strength-based. We looked at culture, we looked at language, we looked at other factors that kept us well. So this opportunity to work together with the Manitoba Centre for Health Policy provided us with an opportunity to link data, these unique data sets, our own RHS data, along with the administrative data at the Manitoba Centre for Health Policy and the research data repository. So I'll hand it back to Nathan to talk about our methods.
So as Wanda mentioned, we had data from the First Nations Health Regional Health Survey, which had a variety of indicators that we reviewed in partnership with researchers from the First Nations Health and Social Secretariat that could be used to identify community strengths. We linked those data with the whole Manitoba Population Research Data Repository, which includes approximately 90 databases spanning several domains, including health, education, justice, social services, and a variety of registries. Once we did that data linkage, we went through the 3 different surveys. The surveys were administered to collect information on children, on youth, and on adults. And we reviewed the indicators that were collected in order to identify what might be some community strengths that we can draw upon. We did a factor analysis to identify which one of those indicators hung together to measure different constructs of strength. We used an oblique rotation to account for the potential for correlation amongst these factors. And then to determine the final number of constructs that would be retained for measuring community strength, we used both the summary of eigenvalues as presented in scree plots, as well as an assessment of the percentage of variance explained to get at the final number of factors for adults, for youth, and then for children. And then we retained those factors that had loadings that were greater than 0.4. Finally, because we were interested in measuring community level strengths, we did tests for homogeneity, which means we wanted to identify if there was more variation in these strength-based indicators between communities than there was within a community. To look at the results, this is the first for children. And we see here the red circle highlighting where there was an elbow between on the eigenvalues in this scree plot between 4 and 5 factors. And then as well, based on the percentage of variance explained, we determined that 4 factors were the number of constructs that were measured with respect to community strengths for children. And so these factors included exposure to smoking, exposure and participation to extracurricular activities, whether or not the parent thinks it's important for the child to experience their First Nations culture, and then finally, whether or not the child is able to speak and understand their First Nations language. When we looked at youth, we found that the Regional Health Survey measured 5 factors. Again, this was based on the scree plot of the eigenvalues, and as well seeing the decreasing additional percentage of variance explained with adding each number additional construct. The 5 factors that we assessed here were the youth perceiving that there was community safety, the youth participating in extracurricular activities, the youth responding that First Nations culture was important to them, that they could speak and understand their First Nations language, and finally that they could read and write their First Nations language. And then when we looked at the results from adults, here we found that there was 4 constructs that were measured by the First Nations Regional Health Survey that reflected community strengths. And these included connections to culture amongst that the adult felt strongly connected to their culture, that they were able to understand and speak and write their own language, and that they responded that the community had a set of characteristics, including self-governance and good access to facilities, as well as low crime and strong leadership. When we did for tests for homogeneity, we found that these did in fact reflect community level constructs. And I will turn this back over to Wanda for the final conclusion.
Just to point out that these type of partnerships are very necessary to allow for these kind of analysis and linking of data sets that are most likely in the ownership of Indigenous people. So it's very important for that to include Indigenous context, which includes community and individual level strengths. So we hope that we are able to continue on this pathway and continue to look at other models that include the strength-based approaches to doing research. Miigwech.
Miigwech, Wanda. Thank you, Nathan and Wanda. It was wonderful to hear about this important work. Okay, please, just a reminder, please send any questions and we'll be addressing them after all the talks. So next, I just want to invite Graham Mecredy from ICES to present about collaboration with First Nations communities to produce tailored, community-driven results. Thanks, Graham.
Thank you, Jen. Hi, everyone. As Jen mentioned, my name is Graham Mecredy. Before I begin, I'd like to start by acknowledging the land that I'm presenting today from, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. And in fact, where I'm coming from, Toronto, the word itself derives from a Mohawk word, takaranto, which means the place in the water where the trees are standing. So I'm going to be talking today about collaboration with First Nations communities to produce tailored, community-driven results. So just as a bit of background, we know that First Nations people in Canada and Indigenous communities across the globe face unique health challenges and requirements. This won't come as a surprise to anyone on this call today. We know that people who live in these communities and work in these communities often have a good sense of what these challenges may be, but often need research evidence to support the knowledge that they have from being on the ground in the communities. So this research evidence can be used to advocate for additional funding or advocate for greater access to health services or health facilities. We also know that First Nations community in Canada face challenges in accessing health data that is held in government or in other institutions, really data about those communities. So when we do our work, we're always thinking about data governance and data sovereignty principles. One place where we take direction on these matters is the OCAP principles. So these were developed in Canada and they refer to the rights of First Nations communities to own, protect, and control how their information is used for research and other purposes. So really to distill that down to one idea is that the data, wherever it may be held, is owned by the communities from which it came. So one program we have in Ontario to conduct research projects is called the Applied Health Research Question, or AHRQ program. So these projects are put together to produce research evidence that inform planning, policy, and program development that will benefit the broader Ontario health system. So this is a program that's funded by the Ontario Ministry of Health, and typical users of this program include health system policymakers or providers. So it could be government ministries like the Ministry of Health itself. We get questions from hospitals or different types of provincial health associations or agencies. But one thing that we've managed to do within the framework of this overarching program is to carve out dedicated funding that goes towards conducting projects in collaboration with our Indigenous partners. So that could be First Nations communities or groups of communities together. We work with Métis and Inuit partners as well. It could be Indigenous organizations or leadership organizations. So all sorts of different types of partners that we work with to sort of enable them to access their data that's held on our servers. So this is a roadmap for how these projects typically flow. So this map was put together by the Chiefs of Ontario, who is one of our partners that we work with very closely when we're looking at First Nations projects. So this is the roadmap for if a First Nations community wanted to come and conduct a project with us. So you'll see along the road there's a little smiling faces of a scientist and a project navigator. That is oftentimes myself, the project navigator, Pam, who is also an author on this slide deck. We work quite closely with the communities that come to us and sort of explain who we are at ICS, why we have this data, what type of data we have, and how we can match what we have with what it is that the communities are requesting. So often they'll come to us with very broad questions. It could be something as broad as just wanting to have the health information about their communities. And we'll sort of work with them back and forth to come up with a project and tailor the results that will suit the needs for what they need. So we have a request that they can put together that just gives a bit of information about what they're looking for and how it may be used. You'll see also on there something called a First Nation BCR. So that just stands for Band Council Resolution. Basically, that's just some documentation that comes from the community to show that the community is on board with conducting this work with us. So once we've done the back and forth with the communities to figure out how we can answer the question they have, we take that question away. We do the analyses on our end, and then we present that back to the community partners just to sort of make sure that everything we put together makes sense. Could be checking things as simple as counting that we have the correct estimate for the amount of people that actually live in the community and sort of build from there. Once we've sort of agreed upon the results looking reasonable, we move forward and create a community report that then goes back to the community. They can present that however they see fit on their end to their leadership or to their community members. One thing to note is that along this entire process, the results and the community report, those are only shared directly with the community. Those don't go to the ministry who funds this program. The data that comes out of these projects is owned by the community, and that's where it goes. In addition to that process, we wanted to come up with something, some way to increase research capacity within these communities that we're working with. So we created this Indigenous health data training program. It's something that right now is in a pilot phase, but it's flowing along with the process of conducting a project. So there's information that we explain sort of about who we are and what data we have, things like that. We have some topics that are a bit more broad on health research, and I've listed a few on the slide here. Things like what is data and what it means when we talk about data. We teach them a bit about developing research questions and analytic plans, about understanding and interpreting health data and looking at graphs and interpreting results, and then a bit of information about knowledge translation as well. So it's sort of meant to accompany these projects that we work on and build some research knowledge and understanding within our community partners. So that's all I have for you today. I'd like to thank everyone who took their time out of their day, whatever time of day it might be where you are right now. It's very much appreciated. So thank you very much, and miigwech.
Miigwech and Nyawa. Graham, thanks for sharing about what's happening at ICES. So I want to move on and welcome Mohammed Shahidullah from the Australian Bureau of Statistics to present his presentation, The Use of Data Linkage Methods to Compile Life Tables for Aboriginal and Torres Strait Islander Australians. Mohammed, welcome. Thank you. Go ahead.
So screen share গুলো করি। Screen share. Good. Okay, thank you very much, Jennifer. Good morning, everyone, from Canberra, the capital city of Australia. In this presentation, I will briefly talk about the quality of Indigenous data in the registration system. Then I'll explain the data linkage method that you used to address this quality issues. Then we will see some very exciting key findings of the project. Then I will finish with conclusions and implications of this study. So next slide is about the outline of this project. I think I've done this one. And about the quality of Aboriginal and Torres Strait Islander deaths data. Registration system is excellent in Australia. So you think that almost all deaths of Aboriginal and Torres Strait Islander are registered in the system, but some are not identified as indigenous when registered. Therefore, registration data underestimates the actual number of deaths, and their use overestimates life expectancy. For this reason, before producing life table for this population group, we estimated more accurate number of deaths. And how did we do it? We linked census data to deaths data to derive what we call the indigenous deaths identification rate in the registration data. So linking census records to death records, we link the full census file to all deaths that were registered within 1 year following the census. So far, we have done 3 linkage studies following the 2006, 2011, and 2016 censuses. So linkage methodology, there was no unique identifier in either deaths data or in census data. So we have done the probabilistic linkage methodology. Key linking variables used are name, both first name and surnames, age, sex, date of birth, and residential address. So estimating death identification rates from linked data set. Linked data provides a cross-classification of linked death registration by census records by indigenous status. As I said, we link the census records to death records. Census file has information on people who are alive at the time of the census. Death file has information on people who are also alive at the time of the census, but sadly, they died within 1 year following the census. So if a census record is linked to a corresponding death record, both records are highly likely to be for the same individual. Therefore, the linked data allows a direct comparison of indigenous status of a person recorded in 2 independent collections. That means one is census, another in deaths. And at the aggregate level, this direct comparison allows estimation of death identification rate and adjustment factors. And this slide presents the link census and death records only for the people and children under 15 years of age at the national level. And this is for the period 2015 to 2017. Okay. So in this slide, column represents the death registration classification and the rows, the census classification. If you can see in these slides, we have 3 statuses in all. One is indigenous, one is non-indigenous, and there are some records with not stated indigenous records. And the same classification in both census and death records. And if you can see the big number 29, there were 29 Indigenous deaths based on the death registration classification, and 36 Aboriginal and Torres Strait Islander deaths based on the census classification. That means fewer deaths are registered as Indigenous in registration than in census. So you can also see that there are some misidentification of Indigenous deaths. For example, some deaths which are identified as Indigenous in registration were classified as non-Indigenous in census and vice versa. So how did you calculate the estimate the identification rate using the linked data? Indigenous identification in census was self-reported because people are alive at the time of the census. They can report their status by themselves. Whereas the Indigenous identification in death registration was proxy reported. Someone from the family or the funeral director or the treating doctor identified their Indigenous status in the registration system. So we expect that the identification in census data, which was self-reported, was of better quality than the identification in registration data. So if you use the identification in census as a gold standard, we can calculate the identification rate by dividing the number of Indigenous deaths in registration by the number of Indigenous deaths in census. So if you use data from the previous slides, we see 29 Indigenous deaths in registration. And if you divide this number by the Indigenous deaths in census, which is 36, so it gives the identification rate of 0.81. So how does it mean? It means that out of every 100 Aboriginal and Torres Strait Islander deaths, only 81 deaths were identified as Indigenous in registration. So because of this under-identification of Indigenous status in registration, we have to bump up the registered deaths. And this identification rate was further refined to align Indigenous status reported in census with that reported in our post-enumeration survey. This gives the identification rate of 0.84. So before using the post-enumeration survey data, identification was 81%. After using the identification from the post-enumeration survey, it was increased slightly to 84%. And this refinement was necessary for using the Indigenous identification consistently in numerator and denominator. And this is a unique strength of our study. There have been such linkage study census to dates in some other countries in New Zealand and also maybe in Canada. But we use the identification consistently in numerator denominator so that we remove that numerator denominator bias from our results. The next slide. This slide presents the date identification rate and adjustment factor. Again, for so far I have discussed the identification rate for children under 15 years of age, but we have done similar calculation for other ages. And this slide shows the identification rate for all ages, again for Australia for the same period. As you can see at the bottom of this, identification rate for Australia for the whole country was 92%. 92%. So we have to adjust the registered date up by the adjustment factor of 1.02. We adjust it up. And if you look at the Northern Territory, with identification rate was 104%. That means there is slight over-representation of Indigenous status in registration compared with census. We adjusted the registered dates in the Northern Territory down by the adjustment factor of 0.96. So once we have estimated the identification rate and the adjustment factor, we adjusted the registered dates based on this identification factor and then use adjusted dates data to calculate life tables. Life tables for Indigenous people are produced only for New South Wales on the state, New South Wales, Queensland, Western Australia, Northern Territory, and Australia. As you can see on the screen, Identification rate for the rest of the state territory, which includes Australian Capital Territory, Tasmania, and Victoria, was only 55%. Identification in registration was 55% compared to census. So we did not produce any life table for the smaller jurisdictions. We thought that it was not sensible to make such a big adjustment to the registered dates and produce life tables for this group. So again, repeat, I produced life tables only for New South Wales, Queensland, Western Australia, Northern Territory, and Australia.
1 more minute, thanks.
Okay, so this is the life expectancy slides. As you can see, we have produced life tables for these 4 groups. For Australia, Indigenous life expectancy was 71.6 years for Indigenous males and 75.6 years for Indigenous females. If you look at the state territory life expectancy, Queensland has the highest life expectancy, 72 for males and 76 for females. And Northern Territory had the lowest life expectancy, almost 66.6 for males and 69 for females. At the national level, there was a difference of about 8 to 9 years between Indigenous and non-Indigenous life expectancy. Life expectancy has improved about the years, but still there is a big gap remains, about 8 to 9 years at the national level. And the difference was even higher at the state level, difference of 12 to 13 years in life expectancy between Indigenous and non-Indigenous group. It's a big, big gap. So in my concluding slide, statistical data linkage method has successfully been used to produce high quality expectancy estimates, life expectancy estimates for Indigenous Australians. This has implications for accurately measuring and monitoring the Council of Australian Governments closing the gap target in life expectancy estimates between Indigenous and non-Indigenous Australians. I'll stop here. Thank you for listening.
Thank you very much. Thanks for sharing your important work. So I want to invite our last group of speakers to present. So this is Simon McBeth and Jacinta Paranihi, who are going to present. They're from Stats New Zealand and presenting on access to linked administrative data through an Indigenous cultural lens. Welcome, Simon and Jacinta.
Tina koutou I ngā iwi take o te ao, he mihi nui ki a koutou katoa. A very warm and hearty Aotearoa New Zealand greeting to you all. Much like our esteemed colleagues, we'd also like to acknowledge the traditional landowners of Wellington, the area of which we are doing our presentation. They are Te Atiawa, Ngāti Toarangatira, and Ngāti Tama. Nō reira, tina koutou katoa. We are Jacinta and Simon, and we work at Tatauranga Aotearoa, Statistics New Zealand, or Stats NZ. Our presentation today is access to linked administrative data through an Indigenous cultural lens, focusing on a Māori principles-based framework we published called Nga Tikanga Paihere. We'll share what it is and how and why we are using it.
Can I ask you, Simon and Jacinta, can you turn on your video?
Yeah.
Sorry for interrupting.
That's all right.
I'll keep going.
Wait one. Here we go.
All right. Aotearoa New Zealand is a young nation with a blended history of Māori, European, Pacific Island, and Asian influences. With a population of 5 million, there is a melting pot of cultures who call this place home. Māori culture is core to Aotearoa New Zealand's national identity, largely through a treaty agreement signed in 1840 between the British Crown and Māori. Our legal system, for example, is founded upon treaty principles of partnership, protection, and participation. New Zealanders, or Kiwis, share the values of caring, and supporting each other, showing hospitality and protecting the natural environment. Despite strong Māori cultural influence on our society, Māori people struggle with inequity across many domains, including social, economic, and health, among others, many others. This has been entrenched through colonisation, with consequences passed on through generations. Similar patterns exist in our data system, highlighted recently by strong Māori advocacy of Indigenous data sovereignty, in particular securing the rights and interests of Māori in relation to their data and digital ecosystems. In response, we created a principles-based framework, the essence of which is Māori customary values and practices, which we call tikanga or tikanga Māori. State NZ built this framework with academics from the University of Waikato, namely Associate Professor Maui Hudson of Te Kotahi Research Institute, along with a host of others. After a year of testing and iteration, it was published this year in March. So for a lot of us here at Tauranga Aotearoa State NZ, Nga Tikanga Paihere is very new, and we're pleased to share our journey so far.
So Stats NZ works with a range of organisations to provide the world-leading integrated data infrastructure, or IDI, to help improve New Zealanders' lives. There is actually a brief overview of the IDI in the additional content section of this conference, which is well worth checking out. Nga Tikanga Paihere, the tikanga framework, is designed to ensure data use is carefully considered and practice occurs in good faith. It also builds public trust and confidence in the way that Stats NZ manages administrative data. It aligns with the 5 SAFEs framework from the UK for microdata access. Nga Tikanga Paihere reminds data users to have appropriate skills and experience and establish suitable relationships with communities. They maintain public trust and confidence to use data, use good data standards and practices, have clear purpose and action, and balance risks with benefits. The researchers use the integrated data for projects in the public interest. The data comes from government agencies, including Stats NZ, and non-government organisations. Some of the data is considered highly sensitive, as it includes individual personal data relating to health, justice, social welfare, tax, education, business, and more. Examples of recent projects that have gone through the application process and have received positive remarks regarding their commitment to Nga Tikanga Paihere are Education Choices and Impact for Māori Youth, which was run by Tūhono, a Māori-led Te Ao Māori Wellbeing project. Kāinga Whānau Ora, a framework for improving whānau wellbeing, which was researched by a private company, Synergia Limited, who were working in partnership with Te Tihi, a Palmerston North-based research entity, and Revealing the Realities of Racism for Rangatahi, which are young Māori, in Aotearoa, New Zealand, by the University of Auckland.
Access to microdata is managed through an application process, and researchers wanting the data are assessed on 10 tikanga, Māori values. These include pūkenga, which talks about skills and expertise, aligned with whakapapa, the extent of community relationships that researchers have, pono, which looks at accountability and transparency mechanisms in the project, as well as tika, which speaks to the value of the research for all. Yeah. Based on the premise that what's good for Māori is good for all New Zealanders. And the next ones are wānanga, the organisational support, and kaitiaki, data stewardship and data governance, wairua, community good, and Māori, data transformation and provenance, and tapu, sensitivity and risk, and noa, benefit and opportunity. Nga Tikanga Paihere is used in the review process. It may surface gaps in the applications that are then the target of recommendations that we make to researchers. Data access for research of a sensitive nature is not necessarily restricted, We aim to balance between, well, we look for a balance between good research objectives, appropriate conduct, and respecting and maintaining the integrity of all those involved. Why do we need Nga Tikanga Paihere? Simply because trust is core to the relationships we build around data. And you need the trust in order to collect people's data, and then it needs to be maintained in order to reuse the data without gaining the explicit consent. Therefore, we need Nga Tikanga Paihere for participation in relationships with Māori. Nga Tikanga Paihere supports the idea that researchers work safely and respectfully with Māori communities, particularly in the social, health and justice sectors. The days of research on Māori communities without meaningful Māori participation are over. If research is to contribute towards real and improved outcomes for Māori, then it must have strong Māori participation. And the second point, transparency. As you are aware, sharing, linking and integrating data is very complex. And it is very hard for individuals to give consent for their data to be repurposed. But we can at least be transparent about what is happening to that data, how it's being used, who's making decisions over it, how it's being kept secure. There are concerns if the public aren't engaged on certain matters. So it's important to notify them about new approaches, especially in technology. We had an example here earlier this year. The New Zealand Police trialled an algorithm that searches social media for face matches without telling the government, the Privacy Commissioner, or the public. They told nobody. And the third point there, addressing bias in the data. If the input data are biased, the results will be too, and any knowledge that's derived from that data will be biased as well. If that data is not representative, then the results won't be too. And for Māori communities and others, like our Pacific peoples here in Aotearoa, there's a risk of raising inequity if that bias is not addressed. Nga Tikanga Paihere was designed to help researchers understand that by following tikanga principles, we are respecting those communities represented in the data who are most affected by our work.
So what are our objectives at StatsNZ? Tikanga is about upholding the integrity and the respect of the people and the places and the things that matter to them. In Aotearoa, New Zealand, Nga Tikanga Paihere reminds us that each data point represents a person and their stories. This is particularly important for those who need timely and relevant data to solve life's toughest challenges. Nga Tikanga Paihere is the first of its kind, bringing a uniquely Māori Aotearoa New Zealand context to our work, influencing the local and international data systems. While we are still assessing its impact on society, it has potential to boost the work of others working tirelessly to lift the equity for Māori. And for a large proportion of StatsNZ staff, this is an opportunity for us to learn about tikanga and how these values can guide our work, contributing to an organisational shift in culture. And that culture can spread further than StatsNZ and go through all of New Zealand government and academia. We really look forward to any questions, comments about the presentation, but that's the end of ours. Thank you.
Kia ora, thank you.
Wonderful, thank you so much. Okay, well, we have had an incredible trip around the world, I think, with all these experiences that have been shared. So I want to thank the speakers and also encourage people who are participating in this session live to contribute questions to the live Q&A. So we have a few questions that have come in. So I wanted to turn our attention now to some of the questions. And so the first one is for the team from Manitoba, Canada. And the question is, were there any surprises from your factor analysis? Were there any key constructs that you expected to see that didn't emerge or that were incorporated into broader categories?
That's a great question. When we were going through the sets of questions for each of the age groups, there were roughly 50 questions from each that we considered. And one of the more surprising ones that ended up emerging was for children, the exposure to smoking in the home. We didn't expect that to consistently come out. We did this a few different ways and iterations, and consistently that construct hung together really, really strongly and emerged in all of the analyses. What didn't emerge either through, primarily because of insufficient loading, so loadings of 0.2 or less, there was a series of questions for both youth and children asking about how the child or how the youth is exposed to First Nations culture. So for example, do you learn about your culture from community members? Do you learn about your culture from family members? Those questions we anticipated would hang together really well in the factor analysis, but in fact ended up not. So that was, we spent a lot of time talking about what that might mean and we actually don't have a lot of really good understanding just yet about why that might be. Wanda, is there anything from your recollection from our discussions that you want to add to that I either got wrong or missed?
No, actually, no, I don't recall, but I do recall we had some discussion around breastfeeding and how breastfeeding didn't emerge as one of the factors that we would align with the community strength. Yeah. But I'm sorry, I can't recall the details.
No, that's, yeah, the breastfeeding also, because that was a traditional practice that was taken from First Nations communities through practices like the residential school program. We actually anticipated that as coming out in some of the early child health indicators as a community strength, and it didn't. So that was also surprising.
Thank you very much. And I'm interested to know, personally interested to know how well that sort of connects with community perceptions of the strengths that, you know, and how that is interpreted by community in community-based ways. Did you have any additional thoughts or future plans to think about how that looks?
Yeah, that's a, and that aligns with Dr. Schul's question about the integration of qualitative research. We actually had we've mapped out a series of sharing circles and visits to community. We did that at the start of our project. We went to a variety, several communities to learn about just about the community itself, and we wanted to come back and talk to them about their perceptions of community strength. And we had them scheduled for this summer, and then COVID happened. So now we're trying to figure out alternative ways, because many of the communities' internet is a little bit challenging to get a reliable Zoom connection for. So we're currently mapping out, in fact, we had a meeting last week about alternative mechanisms to gain that information and document their experiences.
Thank you. And just so drawing on Michael's question there, he asks if any of the presenters can comment on the integration of qualitative research with quantitative research for community-based research, and any particularly successful models of doing so that you can point to. Does anyone else have any thoughts or examples?
Is that specifically for the Manitoba team?
No, it's actually for any presenter, but would you like to contribute, Wanda?
Yeah, I think that part of my dissertation work involves doing quantitative research by building in qualitative methods, not necessarily using a mixed methods approach, but by using knowledge keepers and community members and community knowledge to inform the research, either by either by having them involved in selecting the indicators, how to frame the indicators, and having them involved in the interpretation. So it's not necessarily doing a mixed methods approach by using those Indigenous knowledge, Indigenous science to really build the context around the data.
Thank you so much for that. Anyone else with comments around the integration of the qualitative and the quantitative in the way that Wanda talks about it, or other ways?
Jennifer, maybe I can just confirm what she said. Yes, we can have both qualitative and quantitative measures. When you do the quantitative analysis, you can quantify the impact of some variables on something else. But if you do not do the analysis, it's happening.
Okay, it's not me frozen. I'm unfortunately, I think we've got some connection challenges. Mohammed, you were frozen for a moment, but I can see you moving now.
Okay. So what I said is that yes, we quantitative one, you can answer, you can quantify the impact of some on something else. But if you want to answer the question why it's happening, so that the general people can understand, you can go back to the community, say, yeah, we know the impact of this and we also the reason for this, then you can address. Does it make sense?
Thank you, Mohammed. Yes, thank you. Okay, so there's a lot of questions coming into the Q&A, which is very exciting. So maybe I'll just move on to another question. So there were a couple of questions for Graham. Some questions about the AHRQ program itself, the Applied Health Research Question Program, but I can see someone else has also given a link in that discussion to learn more about the Applied Health Research Question Program. But Graham, the questions are you able to advise on whether or not there is a process? Sorry. So I think the questions are about the pilot program, how many people have been involved, and I'm not quite sure how to read the first part of the question, but I think really just maybe you can comment on the effectiveness of the program, the effectiveness and the impact of using the data for using the First Nations data at ICES. So both the impact of the capacity building training and also the impact of the use of the data.
Sure, yeah, I'll start with the data. So, I mean, we've been using the AHRQ program to conduct these Indigenous focused projects fairly consistently, starting like within the past 4 or 5 years and sort of building that over time. At the start, we had sort of 1 or 2 projects a year. And as sort of word of mouth has spread that this is an option and people hear more about it, it's really ballooned up until where we are now, especially with COVID going on. We have all sorts of projects on the go right now. I think we're more in the like 15 to 20 projects that are actively going on right now within this program. So we've really grown that number a lot over the years. One of the benefits is that communities can just come to us directly with their questions and we work with them to answer it. So, I mean, having those tailored specific results that the communities can use, that is specific to them, and they can take those and use those how they need to advocate for what they need to advocate for, I think is very powerful. In terms of the pilot program, so that's relating to the research training piece that I mentioned at the end. We had 3 communities participate in the pilot in our first round there. And we actually just started the second wave of training just this past Friday, actually. We had about just over 30 representatives that I think came from 5 or 6 different communities. So again, that's something that we're just sort of getting off the ground, but it sort of goes hand in hand with the research piece and conducting the actual projects, but really sort of helping to spread the research acumen within our partners.
Graham, thank you. Just a couple of follow-up questions. One is just, is there anything we've learned from the AHRQ process that could be useful to others? And then I can interpret the first part of that question that I was struggling with before, and I think it's really, is there a process for using the data for other research and analysis activities outside of the AHRQ program? So if you could just address those 2 additional questions.
Sure. So in terms of learnings from the AHRQ program in particular, I think, so this program wasn't designed specifically with Indigenous research in mind. It was designed to help evaluate the healthcare system and how it's working. So I think one takeaway from that is that sort of we've found a niche use for this program that was already existing. And I mean, the ministry was very receptive to sort of carving aside that separate funding for these projects. They've also been very receptive to changing the process for how the projects are typically conducted. In most AHRQs, the deliverables are shared with the ministry, but as I mentioned in the presentation, that's not something that's done when we work with these Indigenous partners. So I think the learning there is that there are opportunities to conduct these types of projects within existing structures that may exist within your regions. So sort of, I guess, thinking outside how those things may have been originally designed and using them for another purpose. And in terms of other researchers accessing some of the Indigenous data that we have, there's certainly processes for that in place. They would look much different than the process that I presented in the slides, which was for First Nations communities coming forward and looking to access their own data. So when a researcher wants to try and use that data, certainly the process is very different. We have data governance agreements in place that sort of govern how people are able to use that data and how it gets accessed. There's data governance committees with some of the partners that we work with that sort of take in requests to use the data, evaluate if they're appropriate, what sort of engagement they have with partners, and they make decisions on whether a researcher in collaboration with some sort of community partner or Indigenous organization is allowed to use the data for those purposes. So we're sort of the data stewards in that equation. So, I mean, the data sits with us, but we're not, at the end of the day, the ones deciding how researchers gain access to it and who is able to access the data.
Thank you, Graham. So there's another question here for Mohammed. Mohammed, it's about the ABS, which I think is code for Australian Bureau of Statistics. This is what happens when you're not from the country the question's about. The Australian Bureau of Statistics identification of Indigenous status in deaths. Has the method been published? And how do we access a more appropriate way of ascertaining Indigenous status in the NDI, for example, or the state-based death registry data when using Australian linkage data?
Yeah, thanks for the question. Yes, we have been publishing the linkage results since 2008. As I said in my presentation, we have done 3 linkage studies so far. One following the 2006 census, another after 2011, and the last one after 2016 census. So all 3 linkage studies have been published. How we did the linkage and what sort of life experience we get, how much improvement has observed from 2008 to 11, and then 11 to 16. So all have been published. I can send you a link maybe after this presentation. So Jennifer, what was the second question?
So how do we access a more appropriate way of ascertaining Indigenous status in the NDI, for example, or the state-based death registry data? The National Death Index is NDI. Thank you, Lisa.
Yeah, I know. Yeah. So what do you do? So you are there at the ABS. We get all the deaths data registered by different state territory registries, and we get the monthly data file from each of them. And after this, we compile all the statutory data, monthly data, into a calendar year-based data. So NDI, so I think it's the different one, but what we are doing at the ABS is the collection of all data that we receive from the state registers, and then use this for the linkage one. It's a pool data set from all the registries across across Australia.
Thank you very much. There's one last question that I just wanted to highlight for our New Zealand colleagues. So this question, thanks to all presenters for great presentations. Noted that New Zealand has mapped the 5 safes to their Maori data framework. Are others incorporating or planning to incorporate the 5 safes framework or approaches into their frameworks? And maybe if Simon and Jacinta, you want to comment about that incorporation of the 5 safes approach, and then others, just sort of a yay or nay if that's something that you're working on.
Yes, so I mentioned that Nga Tikanga Paihere is very, very new. We are socialising with other agencies here in New Zealand, and we've got lots of interest from the likes of Oranga Tamariki, that's our Ministry for Vulnerable Children, and Health Promotion Agency, Department of Internal Affairs. I'm thinking of all the acronyms, that's why I'm thinking, what are they called? Ministry of Social Development. We've got interest. We're very early in the process, though, in terms of getting it implemented. So that's our focus right now.
We found the 5 safes a very solid framework to begin with, and if you add a cultural aspect to it, just strengthens it quite a bit more. It's very good as a base one, and we know that ABS, or the Australian Bureau of Statistics, as we call them too, they have been using it as well for the basis of their access for microdata.
Wonderful. It's really helpful to see. It's so helpful to learn what others are doing and how they're doing it. There was a wonderful pre-workshop on Indigenous data and Indigenous data linkage as well. I think we may be running out of time. So thank you so much, everyone, for this wonderful conversation and for all of your presentations.
Thank you.
Thank you.
Thank you all.
Thank you.